Collectively, we can't afford it. U.S. President Donald Trump and HHS Secretary Robert F. Kennedy Jr. have moved to slash funding for addiction treatment programs and research, saying the money should instead be spent on efforts to make America healthy again. State and county public health departments and nonprofit groups are reeling after the Trump administration announced abrupt cancellation and revocation of roughly $11.4 billion in COVID-era funding for grants linked to addiction, mental health, and other programs. This is chopping things off in the middle while people are actually doing the work, said Keith Humphreys, an addiction policy researcher at Stanford University, who also volunteers doing harm reduction work with people in addiction. He warned the move could trigger layoffs and treatment disruptions. Services will be dropped in the middle. Bang, the clinic is closing. It's a brutal way to make these cuts, Humphreys said. The federal grant funding had been scheduled to run through September 2025. In a statement sent to NPR, a spokesperson with the U.S. Department of Health and Human Services said it made sense to freeze the program immediately. The COVID-19 pandemic is over and HHS will no longer waste billions of taxpayer dollars responding to a non-existent pandemic that Americans moved on from years ago, the statement said, adding that the Trump administration will refocus funding on America's chronic disease epidemic. Addiction experts told NPR they are now bracing for what many believe will be deep cuts to Medicaid funding, which provides the largest single source of insurance coverage for drug and alcohol treatment nationwide. Take better care of yourself. We can't do it for you.